In this video, we'll walk through keeping a sleep diary, the role of natural sleep aids, and sleep disorder. Monitoring your sleep can help you identify patterns, spot potential issues, and make adjustments to further improve your rest. Monitor your sleep to see what's working. By the end, you'll have all the knowledge and tools you need to start sleeping better and reaping the many benefits that come with being well rested. Once you've optimized your sleep environment, set a consistent sleep schedule, and established a relaxing bedtime routine, it's important to pay attention to how you're actually sleeping. Keeping a sleep diary, one of the best ways to track your sleep, is by keeping a sleep diary. This is a simple log where you record details about your sleep each day, such as what time you went to bed and woke up, how long it took you to fall asleep, how many times you woke up during the night, how long you slept in total, how rested you felt upon waking, any factors that may have affected your sleep, stress, noise, etc. You can use a notebook, spreadsheet, or app to record your sleep data. Try to fill out your sleep diary as soon as possible after waking up, while the details are still fresh in your mind. Be as consistent and accurate as possible, even on weekends or days when your sleep is disrupted. After a week or two of tracking, look for patterns in your sleep data. Are you consistently getting enough hours of sleep? How long does it typically take you to fall asleep? Do you tend to wake up at certain times during the night? Identifying sleep issues. Keeping a sleep diary can also help you spot potential sleep issues that may need to be addressed. Some common sleep problems include insomnia, difficulty falling asleep, staying asleep, or waking up too early and being unable to get back to sleep. If insomnia persists for more than a few weeks, it's worth talking to your doctor. Sleep apnea, characterized by pauses in breathing during sleep, often accompanied by snoring. Sleep apnea can lead to daytime fatigue and increase the risk of other health issues. Restless leg syndrome, RLS, an uncomfortable sensation in the legs that causes an irresistible urge to move them, often worse at night. RLS can make it hard to fall asleep and lead to frequent wake-ups. Narcolepsy, a neurological disorder that affects the brain's ability to control sleep-wake cycles, leading to excessive daytime sleepiness and sudden sleep attacks. Delayed sleep phase syndrome, DSPS, a circadian rhythm disorder where a person's sleep schedule is significantly delayed, making it hard to fall asleep at a typical bedtime and wake up in the morning. If you notice symptoms of these or other sleep disorders, it's important to talk to your doctor. They can help diagnose any underlying issues and recommend appropriate treatment options. Adjusting your sleep routine. Even if you don't have a diagnosable sleep disorder, tracking your sleep can reveal areas where you might need to make adjustments to your routine. For example, if you're consistently taking a long time to fall asleep, you may need to adjust your bedtime to be later or work on creating a more relaxing pre-sleep routine. If you're having trouble sticking to your sleep schedule on weekends, you may need to be more consistent with your wake-up time or adjust your schedule to allow for a bit more flexibility. Remember, making changes to your sleep habits can take time. Be patient with yourself and make adjustments gradually. Stick with your new routine for at least a few weeks to see if it's making a difference in how you feel. The role of sleep aids. If you're still having trouble sleeping after optimizing your environment and habits, you may be wondering about sleep aids. While there are many over-the-counter and prescription sleep medications available, it's important to use them cautiously and under the guidance of a doctor. Some common types of sleep aids include melatonin, a hormone that regulates sleep-wake cycles, available as a supplement. Melatonin can be helpful for jet lag or shift work, but may not be as effective for chronic insomnia. Natural remedies. Some people find relief from sleep issues with natural remedies like valerian root, chamomile, or lavender. However, the effectiveness of these remedies is not well established, and they can still have side effects or interact with other medications. Valerian root, an herb that increases gamma-aminobutyric acid, GABA, levels in the brain, promoting calmness and sleep. Chamomile tea contains apigenin, an antioxidant that binds to certain receptors in the brain that may promote sleepiness. Tart cherry juice, rich in melatonin and tryptophan, which increases serotonin levels to help regulate sleep cycles. Glycine, an amino acid that improves sleep quality by lowering body temperature at bedtime. Magnesium plays a role in regulating melatonin and activating the parasympathetic nervous system to relax the body. Lavender. The scent of lavender is thought to decrease heart rate and blood pressure, promoting relaxation. Passion flower. This herb increases GABA levels similar to valerian root, reducing anxiety and promoting sleep. 5-HTP, a precursor to serotonin that can increase melatonin production and sleep quality. Lemon balm contains rosmarinic acid and galangan, which may have sedative effects on the brain. Here are some groups who may want to avoid or use caution with lemon balm. Pregnant women. There is limited research on the safety of lemon balm during pregnancy, so it's best for pregnant women to avoid using it unless approved by their doctor. Children. Lemon balm supplements are not recommended for children as the potential risks and proper dosages are not well established. Those taking sedatives. Lemon balm may cause excessive sedation when combined with other sedative medications or supplements, so it should be avoided or used with caution in these cases. Those with thyroid issues. Some evidence suggests lemon balm may interfere with thyroid hormone levels, so individuals with thyroid disorders should consult their doctor before using it. Those scheduled for surgery. Lemon balm may interact with anesthesia, so it's recommended to stop taking it at least 2 weeks before a scheduled surgery. While generally regarded as safe in normal food amounts, those with certain medical conditions should exercise caution or avoid using concentrated lemon balm extracts or supplements until consulting with a healthcare professional to prevent any potential adverse effects or interactions. Many of these natural sleep aids work by increasing relaxation, reducing anxiety, regulating sleep hormones like melatonin, or providing calming effects to help initiate and maintain sleep. Before trying any sleep aid, it's important to talk to your doctor. They can help you weigh the potential benefits and risks and determine if a sleep aid is appropriate for your situation. Behavioral strategies for better sleep. In addition to optimizing your sleep environment and habits, there are several behavioral strategies that can help improve sleep quality and duration. Cognitive behavioral therapy for insomnia, CBTI, a type of therapy that helps identify and change thoughts and behaviors that interfere with sleep. CBTI can be done with a therapist or through self-guided programs. Relaxation techniques, practices like deep breathing, progressive muscle relaxation, or guided imagery can help calm the mind and body in preparation for sleep. Mindfulness meditation, focusing on the present moment and observing thoughts and sensations without judgment, can help quiet the mind and promote relaxation. Exercise, regular physical activity, particularly in the morning or afternoon, can improve sleep quality and duration. Just be sure to avoid vigorous exercise close to bedtime. Light therapy. Exposure to bright light in the morning can help regulate circadian rhythms and improve sleep, particularly for people with disorders like DSPS or seasonal affective disorder. Incorporating these behavioral strategies into your overall sleep plan can help you not only fall asleep faster and sleep more soundly, but also improve your mental and emotional well-being. When to seek professional help. If you've been consistently struggling with sleep for more than a few weeks, or if your sleep issues are significantly impacting your daily life, it's important to talk to your doctor or a sleep specialist. They can help rule out underlying health issues, diagnose any sleep disorders, and recommend appropriate treatments. Some signs that it's time to seek professional help include consistently taking more than 30 minutes to fall asleep, waking up frequently during the night, and having trouble getting back to sleep, feeling unrefreshed or exhausted upon waking, despite getting enough hours of sleep, experiencing excessive daytime sleepiness that interferes with work, school, or daily activities, snoring loudly or making choking sounds during sleep, having uncomfortable sensations in your legs, or an irresistible urge to move them at night. Sleep issues that are causing significant stress, anxiety, or mood changes. Your doctor may recommend a sleep study to diagnose conditions like sleep apnea, or refer you to a sleep specialist or cognitive behavioral therapist for further treatment. They can also help you manage any underlying health conditions or medications that may be impacting your sleep. By implementing these strategies consistently, you'll be well on your way to enjoying the many benefits of regular, restful sleep. You may find that you have more energy and focus during the day, a more stable mood, and even improvements in your physical health markers like blood pressure or weight. Of course, everyone's sleep needs and preferences are different, so it's important to remain flexible and open to experimentation. If something isn't working for you, don't be afraid to make changes and try new approaches. The key is to stay committed to prioritizing your sleep and making it a non-negotiable part of your daily routine. If you find yourself continuing to struggle with sleep despite your best efforts, don't hesitate to reach out for help. Talk to your doctor, a sleep specialist, or a therapist who can provide personalized guidance and support. Remember, investing in your sleep is investing in your overall health and happiness. So here's to creating your ultimate sleep sanctuary and unlocking the power of restful, rejuvenating sleep. Sweet dreams.